first or non-medical management first?
Yes.
It depends on the patient. So don't ask me this question, medical first or non-medical. I don't know. You have to decide according to the patient. If patient is like a counseling station, you can give non-medical advice first. Now, if patient is there, I can't breathe. Don't smoke, don't drink alcohol. It doesn't make sense. So that's what is written. Giving health and lifestyle advices to an acutely ill patient is not making any sense, isn't it? So we have to be very careful. Nobody is going to tell you medical or non-medical first. You will decide for that particular patient, right? Time is the problem. Do you have this question in your mind? Why we have this time constraint? We should have like unlimited time.
You take only one patient in the whole day.
One patient the whole day. Okay, in the hospital, to be honest, if you are working in an acute medical unit, if you're able to clerk one patient in an hour, it's okay. They say quality is what they want, right? But why it is time bound? You know, consultation in the GPs, they are time bound as well. Anybody who's registered with the GP here? Have you been to GP? How many minutes they give in one consultation?
Maybe 10 minutes.
10 minutes. It's a 10-minute slot. And you know, when you call the GP surgery, when I'm saying GP surgery, it means GP clinic. Don't think we're doing surgeries there. Many candidates ask me this question. So GP surgery is the name of the clinic, GP surgery. Right, so when you book the appointment with them, they ask you what's the problem, you know, a bit of history on the phone itself. And if you have booked it saying, okay, I've got cough, that's why I want to book the appointment, they're like, okay, fine, come maybe tomorrow or day after, whenever the slot is available. And they will take detailed history about cough, associated symptoms, everything they'll ask. Suddenly you said, I've got knee pain as well. You know what they will say? Please book another appointment. Just talk about cough. Why? Because if they start elaborating the second symptom as well, it's going to take time, and the next, and the next, and the next consultation, everything is going to be delayed, right? So that's how it works. So they are actually training us from day one. Like we have to do things in that time frame, right? So time is very important. In the exam, will you be having your watch? No. Will you find a clock in the room? No. So how are you going to get the idea about the time? So there is a bell actually. So there is a bell. What happens when you're reading the task outside? So you get how many minutes? 1.5 minutes, right? After 1.5 minutes, there will be a bell saying begin. Begin means you open the door, you go in the room. So you have got 8 minutes in the room, right, with the patient. After 6 minutes inside the room, there will be a bell saying 2 minutes left. And after complete 8 minutes, there will be another bell saying move on to the next stage. So that bell is the only thing which will give you a bit of idea about the time. Don't worry, we'll prepare you. We're gonna practice here in the class with the timer. When you give the mock, you will be having this timer as well. So you won't feel like something very different when you go for the real exam, right? So the bell, one bell after 1.5 minutes saying begin, you go in the room, and then you have got one bell saying 2 minutes left, and then move on to the next station, right? So that's how it's gonna work. But now time management. So if you're doing a history scenario, you tell me how many minutes for history, how many minutes for management. Interpersonal skill is how you're talking. We'll talk a bit more about interpersonal skills. It's like how you're making the patient comfortable, but you don't need to spend extra time for that. Time is for history and management. So how many minutes for history, how many minutes for management?
I think 4 to 5 minutes for history.
4 to 5, 4 to 5, and 3 to 4 for management. Any different answer?
3 minutes for history.
3 minutes for history. Very quick. Again, it depends on patient to patient, obviously. Sometimes you see like patient has got one symptom only, so you can do things very quickly as well. But sometimes patient has got many symptoms and all. So when you start elaborating them, it can take a bit longer as well. But still make sure 4.5 minutes. Don't go beyond that. So now I'm going to tell you all the possible questions that you may need to ask, but in the exam, you're not going to ask everything. See, who's a good doctor? Who asks less questions and who gives less medication, right? So if we have to ask every single question, then why they need a doctor? A non-medical person can also do that, right? So we doctors, we know what are the risk factors for this particular condition. So that's why we need to choose the questions. Like for example, lifestyle. You ask smoking, you ask alcohol, you ask diet, you ask physical activity, stress. These are the questions you ask. But do you need to ask all these questions in all the stations? No. I will choose what I need. My patient came to me with shortness of breath, with hemoptysis. I'll ask smoking. I'll ask his occupation. And if I don't have time, I'll skip rest of the lifestyle questions as well, right? I've got a station where something is related to liver. Alcohol is going to be my top priority question. So this is how you need to jump very quickly in your later part of the history. So 4.5 minutes for history taking. So you can have more than like 3 minutes for your management. You know, management is not like giving them the treatment plan. Sometimes they know better than us about their problem because they have checked it on Google. They are literate people. They understand English. So, but they have got couple of questions in their mind, couple of concerns which they want to ask you. So when you give the management, it's not like one-way talk. You have to involve them in the consultation, right? You have to say a couple of lines and you wait so that they can ask the question. That is management. And you know, when we have less time, what happens? You don't give break in between. You just vomit out everything in one go. That should not be the case in the exam. And something happens to us, to everyone, after 6 minutes bell. You know, when it says 2 minutes left, you just change the gear. If you are in second, you just change it to fourth. I know what is happening. So that bell is not something soothing, I would say, when you do, but you have to be very careful. Don't think I have to start my management only after 6 minutes. No, you can't do things in 2 minutes for management. Management is like you have to tell the diagnosis, you need to explain the diagnosis, you need to tell about investigation, you need to treat the patient, medical treatment, non-medical treatment, symptomatic treatment, systematic treatment. I mean, what is the cause for that? Patient has got many queries, obviously they're going to ask you. So you have to answer those. Follow up, warning sign. My God, there are so many things. 2 minutes won't be enough at all. So make sure you give more time.
Is it possible to conclude scenario before 8 minutes?
Right. Okay. So
Or is it a bad thing?
I will discuss two situations. So if you finish early, which can happen. So you know they have given 8 minutes, and what they expect that you should be able to do things in 8 minutes. So you might be doing things in 8 minutes, but you might be able to do it in 7 minutes as well, which is perfectly fine. But they won't let you go out if you're finished early. You have to sit in the room, looking patient and the exam. But you can't go out because even if you go out early, so you might be reading the task, the next one, which is what they don't want. And another situation now, so it's already 8 minutes, but you haven't finished the task. And yeah, just leave the station, and they will tell you, "Thank you, doctor." And he's still talking, "Thank you, doctor." It's very polite way of saying get lost. The thing is, you know, they're helping you out because you are actually wasting your time for the next station as well, because that next 1 minute and 30 seconds for the next station has already started. Plus, they have to prepare that room for the next candidate as well. For example, you're doing blood sampling station, cannula station, catheter station. You will see when you teach you, there will be a lot of mess after doing that station. So examiner has to prepare that room for the next candidate as well. How many minutes they get? Hardly this 1.5 minutes. So that's why they just want us to leave the cubicle as soon as possible, right? So make sure you are done with the important things within that 8 minutes. Anything you're saying after 8 minutes won't be considered, right? So it's better we leave the summary, right? So time management. So 4.5 minutes for history, and try giving more and more time to the management as well, right? Findings, obviously, we'll get findings when you take history, you'll get so many findings in the history. When you do examination, you'll find something in the examination as well. And sometimes they give you investigation reports as well, and you'll find some abnormality in that as well. And you should be able to interpret it properly for the patient. For example, they gave you investigation report saying bilirubin is high, ALT, AST high. So we should know what is the meaning of it, and we should be able to explain it to the patient properly, right? Right, then we have got examination. So make sure we are doing the examination properly, proper examination, and any instrument they have given it to us, so we should be able to use the instrument properly. For example, they are giving us fundoscopy, they are giving us otoscopy, so we should be knowing how to hold that instrument. See, being an intern, being an FY2, it's not like you should know everything, but at least we should know the basics, right? Diagnosis. So when you're taking history, are you sure you'll be able to make the diagnosis? Sometimes yes, sometimes no. So if you're not able to make the diagnosis, then what? They give the differential, that's fine. So even your consultant, when they're taking history in the clinic, it's not like they're able to make the diagnosis all the time. But they have got like few things in their mind. So that's what you need to do in the exam as well. And accordingly, you have to mention we are going to investigate, isn't it? So, so if you're not having one diagnosis in your mind, you can give two. That is absolutely fine. But you know, be a bit specific as well. I'll give you a couple of examples here. So sometimes what happens when you're not sure what's the diagnosis, this is what candidates do. Tell me if it is okay or not. John, you have something. and I'm going to do some further investigation to make sure everything is fine with you. And I'm also going to call my senior, they will also come and help you out. So do you think it is good?
No.
It is not good because otherwise it's very generic line and I can use it with every station. It doesn't make any sense at all, right? You need to go a bit more specific. So for example, patient has got cough, shortness of breath, fever. I know it's the infection, but I don't know which infection it is. Okay. So John, the thing is the history that you gave me that you have got cough, you have got shortness of breath, you have got fever, it looks like you have got chest infection. And there are a couple of things, going on in my mind. First you mentioned that you actually came in contact with your friend who was also coughing, which is taking me towards the diagnosis, which we say are tuberculosis. Moreover, you mentioned that you're taking needles, sharing needles, and you're taking IV drugs. It is taking me towards other infection as well. That is what we say pneumocystic gangrenine pneumonia as well. And it could be normal pneumonia as well. So there are a couple of things, as I said. So we need to investigate you further. So what I'm going to do for your case, I'm going to do a routine blood test for you. I'm going to take your phlegm sample. I'm going to do a chest X-ray. Once I have the report, I'll be in a better position to help you out. And we'll treat you accordingly. I mean, if it is like, say, TB, we can treat you with antibiotics. And if it is pneumonia, we can treat you with different antibiotics. But you mentioned you have got cough. I'm going to give you something for cough. You mentioned your fever. I'm going to give you something for your fever as well. Now you tell me, do you think it makes sense? No. So it's a more elaborative way of management. I wasn't sure what is the exact diagnosis because we can't make the diagnosis all the time just on the basis of few things in the history, right? But don't just say you have something, I'll do something, my senior will also do something. Something won't work. So just go a bit more focused way, like what you want to say. Also, in the history as well, sometimes very when we ask questions, we are very vague. For example, any bowel problem. What you want to know in bowel? You want to know about diarrhea, you want to know constipation, you want to know tummy pain. Be a bit more specific, you'll get better marks in the exam. Any urine problem. What do you want? You want hesitancy in urination or like urgency or frequency or burning sensation or retention or incontinence? What are you looking for? Right? So you can ask one question, very open one, any urine problem? No. Then if you want to know something really specific, go for that. Ask that question as well. You will get better marks. Right?
Sometimes the patient will tell that I'm scared about the cancer,
Okay.
and we have differentials.
Right.
So how will you convince the patient?
Okay, it's not about convince. So he asked me questions. So if we are suspecting cancer, but we want to reassure a bit as well, but it's not like 100%, right? Okay, so you have a doubt it is cancer, so you're gonna definitely investigate the patient.